In this video, we're going to look at different causes of upper GI bleeding. So essentially from your mouth all the way down to the duodenum. And bleeds around these area can cause the patient to vomit up blood, so hematoemesis. So now let us look at some common causes of upper GI bleeding, beginning with esophagitis, which is essentially inflammation of the esophagus. So here we have the stomach, and here we have an inflamed esophagus. And there are different types of esophagitis. We can have reflux esophagitis, GORD, infective esophagitis. Chemical irritants can cause inflammation of the esophagus, as well as there's eosinophilic esophagitis. And essentially, again, it's this inflammation of the esophagus. But while we're talking about esophagus, let's talk about Barrett's esophagus. And Barrett's esophagus is a condition where cells lining the lower esophagus change in morphology. So the esophagus can be divided into three parts. The last part, the third part, the cells that line this area essentially change in shape. So here in this area, we normally have squamous epithelial cells, but these change to Barrett's metaplasia, which can subsequently lead to adenocarcinoma of the esophagus. So the relevance of Barrett's esophagus is that change in morphology can lead to adenocarcinoma, and also pathological findings reveal that there are goblet cells present in the area where they shouldn't be. The next condition we're going to talk about is esophageal varices. So here we have the stomach again, and here we have the veins around the stomach and the esophagus. And esophageal varices develops as a result of portal hypertension, usually. And esophageal varices is where we have dilated vessels, veins, of the esophagus. And these dilated veins, when they dilate, they can rupture. And this is very serious and dangerous. Diagnosis of esophageal varices is using endoscope. So let's zoom into this area here of the esophagus and learn a bit more about esophageal varices in a diagram. So here I'm drawing the esophagus, and these are the veins that drain the esophagus. And the veins that drain the esophagus contain blood. Now in esophageal varices, blood essentially pools in the area, causing these veins to grow, and they can subsequently rupture, causing serious problems. So here we have varices, the pooling of the blood, and the veins that actually drain the esophagus. There are two veins, and they anastomose with each other. These are from the top, the esophagus vein, and the left gastric vein. And these veins, they drain later to the portal vein, then to the liver. But if you have portal hypertension, which we see in conditions such as liver cirrhosis, this blood will backflow to this area, thus leading to esophageal varices. Here I'm drawing an endoscope, which is used to diagnose esophageal varices, but it can be dangerous. And so here I'm drawing an image of what we would see if we were to look inside the esophagus. So we can see these prominent bulging veins full of blood, which can rupture again, and that is going to cause internal hemorrhage, which is very dangerous. The next condition we're going to talk about is Mallory-Weiss syndrome. Mallory-Weiss syndrome has to do with the connection between the esophagus and the stomach. And essentially, it's where we have a tear. So in Mallory-Weiss syndrome, we have longitudinal tears near the cardioesophageal junction. These are superficial lacerations. So if we were to zoom in the area, these are the Mallory-Weiss tears. Mallory-Weiss syndrome is associated with chronic vomiting, retching, coughing, and straining. The next cause of upper GI bleeds is we can have erosive gastritis. Now, erosive gastritis has to do with the stomach. So here we're looking into the stomach, and we have essentially erosions within the layer of the stomach. So erosive gastritis is gastric mucosal erosion caused by damage to the mucosal defense. We can have bleeding with few or no symptoms. We diagnose it using an endoscope. Treatment includes proton pump inhibitors or H2 blockers, which essentially work by stopping acid secretion. Causes of erosive gastritis include use of NSAIDs, alcohol, and stress. The next potential cause of upper GI bleeding are mass lesions, and what I'm talking about are polyps and essentially tumors, cancer. So, for example, we can have mass lesions, which are esophageal tumors, which can be adenocarcinoma or squamous cell carcinoma. And we talked about how Barrett's esophagus can lead to adenocarcinoma due to the metaplasia that occurs at the lower part of the esophagus. Now, we can have also growths within the stomach. They can be benign tumors or malignant tumors. Let's talk about benign tumors. We can have few types. There can be inflammation and hyperplastic polyps, fundic gland polyps, and gastric adenomas. Malignant tumors of the stomach. There are a few types. These can be gastric carcinoma, which is the most common, up to 95%. We can have gastric lymphomas, roughly 5%, and then carcinoid tumors and stromal cell tumors, which are less common. The next condition is Dieulafoy's lesion, which is also known as a Caliber persistent artery. And it's a rare but potentially life-threatening because it causes hemorrhage of the GIT. And as the other name suggests, Caliber persistent artery, it has to do with the artery that supplies the stomach. So essentially, if we were to zoom into the stomach here and we were to look at it through an endoscope, we would see that it's essentially where we have a bulging of a lesion, and this lesion could subsequently rupture, causing a hemorrhage because of the blood that supplies the area. And this can cause severe internal bleeding, which can be fatal. The next potential cause of upper GI bleed is known as angiodysplasia, and it's a common vascular abnormality in the GI tract. It's similar to telangiectasia, and it occurs like all around the GIT, but mainly the colon. Anyway, the morphology of angiodysplasia is that we have elastic, dilated, thin-walled vessels that are lined by endothelium alone. And as I mentioned, it's most often seen in the colon, but we can also see it in the stomach. So if we were to look into the stomach here using an endoscope, we would see potentially angiodysplasia, such as this. The next condition is a very common cause of upper GI bleed. It's just ulceration. Ulceration is erosion of the mucous membrane, and it is similar. Like the risk factors and stuff are similar to gastritis, but it is technically a different condition. Risk factors for ulcer formation in the stomach include excess hydrochloric acid secretion, which can be caused by a few things: Helicobacter pylori infection, use of NSAIDs, and stress. And ulcers can occur not only in the stomach, but also the duodenum. So we can have duodenal ulcers and gastric ulcers. So just looking at a duodenal ulcer here, it's more common than a gastric ulcer, by the way. So here I'm drawing the layers of the duodenum. Here's a lumen, and here we have an ulcer, which is an erosion that goes down through the mucosa, submucosa. Gastric ulcer, similar thing. Now we can have complications with ulcers. There can be bleeding, we can have perforation, as well as narrowing and obstruction. Perforation means that the content can perforate into the peritoneum, which can cause peritonitis and severe inflammation and pain. So those were some causes of upper GI bleeds. I hope you enjoyed this video. Thank you for watching.